Welcome back, you guys. Day 12, Menopause Energized features the 30-day Healthy Heart Marathon. We are on day number 12. Hey, you guys, welcome back to my channel, Menopause Energized. Again, I am Sheila, the health coach, registered nurse with my program, Menopause Energized. We are on day number 12, and we're going to start heading into talking about exercise routine and how healthy it is for your heart. But I thought a good way to start this off would be to set a foundation for the next few days, because it's going to take that long. I don't want to crunch it all into one session, of how important exercise is to the heart, again, especially for us women that's in the menopausal years, because cardiovascular disease is the number one killer in women. So the best way I thought to start this off was talking about exercising and oxygen. Did you know, we should probably know, that oxygen is a nutrient to our body, to our heart? So what I wanted to start off with was just talking about how important oxygen is. So when you exercise, you are exercising your lungs, actually. You are moving that circulation around, and you're bringing it oxygen-rich blood back into your lungs. That is so important to keep your heart functioning. When we are talking about not exercising, or we're just around the house, and say if you're working on a job where you sit all day, do we really concentrate on our breathing? A lot of times we get so busy, we're not really taking deep breaths. We're actually doing some shallow breathing. So it's good to know, to start off before we get into all the exercise, about exercising your lungs. And that is, during the day, concentrate and be mindful of just taking some nice deep breaths in, because again, we get so busy, our breathing sometimes may be shallow. So if you take some nice deep breaths in, it can help with a few things, even when you're not exercising. If you're not getting enough oxygen into the lungs, you're not also, remember I told you when we talked previously that the heart sits here and the lungs sits in between the heart. So whatever goes on with the heart goes on with the lungs. So if we're not getting enough oxygen into the lungs, we're also not getting enough oxygen into the heart circulation. Now, believe it or not, if we're going around, sometimes some of us breathe more than others, and we are doing shallow breathing, there are times you can feel some symptoms from that. Sometimes you can feel really tired. Now, of course, tiredness can come from anything. But just be mindful when you start kind of feeling tired, and you know you've been sitting all day, say at a job, and you've been working. How is your breathing? Are you really taking some deep breaths? So throughout the day, if you can remember, just take a moment, pause, and just do some nice deep breathing. We talked about the breathing exercises in the earlier part of the program, so you can go back to that video and look at that. We won't get into everything about the breathing exercises here, but so important during the day. Just take a couple of moments here and there and do some nice breathing exercises. Sometimes when you're not breathing well, and your breathing is shallow, that means that oxygen is not circulating back up into the heart and lungs like it should. So again, not only will you feel tired sometimes your heart rate can increase. It can actually cause your heart rate to increase if you're not taking enough deep breaths during the day. With that being said, it can also increase blood pressure a little bit. And I know these sound like all simple things. Again, remember I told you my program is about awareness, waking us up of different things that we let go dormant. And breathing exercises is one, because we're all so busy. But if you do some of these deep breathing exercises during the day, especially for if your lifestyle is not real active, like if you have a job where you sit at the desk for 8 hours, which a lot of us nurses do, well, the ones that got out of bedside nursing, because I've been in health coaching for years now, it is important to do the deep breathing exercises. Also, sometimes you may feel like you can't catch your breath. So when that happens, again, nice, slow breathing exercises will help with that. Sometimes you can even feel like something may be sitting on your chest a little bit. We don't want to get that confused with chest pain, anything else dangerous. But sometimes you may feel like you can't get a full breath. I don't know if you all have ever had that. I have. Again, nice, slow, rhythmic, deep breathing exercises. Good breathing helps, again, with lowering the heart rate. It opens blood vessels so the oxygen blood can get through the system. It reduces the blood pressure, as we talked about here, and it improves circulation. Sometimes if you have shallow breathing, you might also feel palpitations. Not necessarily that your heart is running fast, just a little extra beat here and there. That can happen also with shallow breathing. Again, take time out during the day to do some breathing exercises to get that circulation going until you get active and get into your routine exercises. Dizziness is another thing. Well, you know, that's pretty explanatory. I don't know if you remember, kids used to play a game back then. I didn't do it. I'm just letting you know. Where they would hold their breath as long as they could. And sometimes when you do that, you do get dizzy. Well, same thing with shallow breathing. If you're not breathing enough to get the oxygen in, yes, you can experience some dizziness. Again, try to do some deep breathing exercises during the day. You may also get a little bit of chest tightness, but then again, remember that chest tightness can come from other things as well. But again, just be mindful of everything you guys have hopefully have educated you on before in the previous sessions. You will, try to differentiate between whether, your chest tightness is something more serious. And then, this has nothing to do with the heart. Believe it or not, if you feel like sometimes, well, it's going to be due to decreased inactivity, of course, when you feel like you can't walk a flight of steps because your legs get really tired, that's because your muscles are tired in the leg. And one of the reasons could be that you're not getting enough oxygen and circulation to your legs. So you do your deep breathing, and then of course you're going to do your daily exercise routine. You have to pick up your exercise routine because when you let your muscles go untouched and you're not exercising, they will get fatigued, even going up a few flight of steps. Now, when you're not breathing properly, the main thing I want you to get from this, when you're not breathing properly, it makes your heart work harder. And the reason why, because you're not breathing properly, the heart compensates to try, since you're not helping the heart out, the heart's going to compensate and it's going to try its best to push that blood back up in the heart anyway. Well, guess what happens with that? When your heart compensates to try to push that blood back up into the heart because for whatever reason, the circulation is just not good, and that could be for any condition. What happens is the heart will pick up, and this is where you get the palpitations and the fast heart rate from, because the heart is trying to compensate with getting it back in since we're not helping it a whole lot right now. And what happens because of that, you'll have the tachycardia, what we call the high heart rate. So basically, that's where I wanted to set the foundation at today, is letting you know, and this is going to be true when we exercise as well, oxygen is so important. It is a nutrient to your heart. So if you're right now not doing a whole lot of exercises, which I hope you will be by the time we finish this series of exercises and cardiac, for risk for cardiovascular disease, that you will start to see how this all comes into play. So the next few days, we will be talking about exercising. That is so important in the menopausal years because we're at that risk for cardiovascular disease. Tomorrow, we'll start talking about the exercise and the routine, how you should exercise, what type of exercises you should be doing, and how many days a week according to the American Heart Association. And we will break that down because each day we'll talk about the different types of exercises. You think sometimes that maybe just jogging every day, okay, if that's your routine, I don't take anybody away from that, but it's more than just that. And we will get into that the next 3 days. And so until the next time, I will talk to you then, we'll see you. I won't see you, but I will talk to you about exercising and how important it is in the menopausal years. So as always, the way I end, until next time, Take care of your heart. Bye-bye.